Well, as I've described it before, I felt like I was walking on broken glass.
Green Valley resident Alan Balsh has had diabetes for a long time. But in the last few years, despite a good diet and medication, he developed one of the disease's painful complications, diabetic neuropathy.
Well, I'd been told by doctors for years that there was no cure, no solution to diabetic neuropathy. It's something you learn to live with, and I'd become pretty well reconciled to that.
Then he heard an ad for a new treatment and began researching it on the internet.
My first reaction was, this sounds like snake oil to me because of what I've been told for many years.
When he asked his primary physician about it and others about it, most people didn't know anything about it but said, well, you have nothing to lose, why don't you go and talk to them?
Dr. Christopher Maloney and his partner are the only physicians in Tucson offering a surgical treatment for diabetic neuropathy, a progressive painful nerve disorder. Like carpal tunnel surgery for hands, it's a similar operation for the feet.
And so when we operate on people, say, for carpal tunnel syndrome, we would release the areas of compression on the nerve, and their symptoms would get better in their hand. Now we have the same operation for the feet and the lower extremities where we can relieve pressure on nerves, reduce pain and restore sensation, and actually help improve their balance.
Long-term high blood sugar can damage nerves, causing pinching, swelling, and of course pain. By decompressing these nerves, Dr. Maloney says the pain goes away.
And much like tying a rubber band around your finger will cause pain and numbness, we cut that tight little rubber band, or we cut the area of tightness on top of the nerve so that the nerve can now function more normally.
The patients themselves were the ones who made me think of it because they were so happy with their hands. They kept asking me why I couldn't help their feet. And what we've developed is against tradition. The correct answer in medical school and medical training is neuropathy is a medical disease, and you wouldn't think a surgeon could help it.
Dr. Ailey Dellin pioneered the new approach. Currently, he is a professor of plastic surgery at the U of A and at Johns Hopkins. He started developing the technique in the mid-'80s, and today his nerve workshops have trained over 100 doctors around the world.
No one's had an amputation. Patients get balance back in their feet. They don't fall. They don't break their hips. They're not admitted for infections to hospitals. They can take less pain medication. This will be a huge change in healthcare costs for the entire United States. So we're very excited about this, and we realize we have to continue to work to educate doctors and patients that this is something, although it's against tradition, works and is reproducible.
And with such a high incidence of diabetes in Arizona, this was a good home for he and Dr. Maloney's Institute for Peripheral Nerve Surgery.
Not a week goes by where I don't see somebody with diabetes who's got pain, numbness, or has had a relative who's had an ulceration or an amputation.
A native Tucsonan who returned here after finishing medical school, Dr. Maloney's performed over 50 procedures.
I actually went to a nerve course in Baltimore, one of the first nerve workshops, to learn this technique. And I was completely blown away when I met patients who had had one leg operated on that were coming back for the second leg, and they couldn't wait to get it done.
But the treatment is still relatively new, and even Balsh's daughter, a doctor, had her doubts.
And I told her about this and got a few chuckles from her, as most physicians hearing about this for the first time are, but she was at least interested enough to come down here and spend a day with Dr. Maloney in his clinic and actually observe several cases, and became convinced that the great efficacy of this particular procedure.
After getting the green light from his daughter, Balsh underwent the hour-and-a-half outpatient procedure last March.
I could tell a difference, particularly in the right foot, the first surgery I had, as soon as I woke up from the surgery. I felt more feeling or sensation in the toes of the right foot, which is about the only thing exposed from the bandage. And Dr. Maloney, who did the surgery, came in and tickled the bottom of my feet, and I jumped, which I hadn't been able to feel for some time.
Now, it was so successful, you actually went back and did your other foot.
Yes. Oh, yes. Couldn't wait, as a matter of fact.
But this operation isn't the answer for everyone with neuropathy.
Unfortunately, a lot of the patients have waited too long and they've already developed ulcerations and amputations, and that makes any sort of success much more difficult to predict.
Walsh is one of the success stories. Often housebound because he was reluctant to walk, now he has a newfound confidence.
I found out one day after I'd done just the right foot. I was walking through Safeway and I noticed I was walking much faster than I'd walked in years, literally, and was amazed at the lack of pain.
And our best way of getting the word out is our patients. Our patients are really our best advocate. Oftentimes they've had pain for 15 or 20 years. They've been told that nothing can be done. And then when you actually help them, they actually go out and they become your disciples as they preach the good news. And so that's how we end up getting a lot of publicity.